So all participants, please can you mute yourself unless you are speaking. Also, please use the hands up functions in the MS Teams to ask a question, or use the chat box if you need to ask a question. Also, can you keep your contribution short so as to allow as many people as possible to speak? We have got quite a number of people, a large numbers actually, have confirmed attending today, so it's quite popular. Also, please, when you want to speak, can you say, what you're studying and where before you speak? And I also want to remind everybody that this is a safe place to share your experiences. So please feel free to speak and share your experiences at this platform. One other important thing to let you know is that our regional director, Lisa Elliott, has come in to attend today's session. That is a very strong signal that for London region, Lisa and her team take student issues very seriously. So I want to thank her for attending, because that's very important. And your issue is our issue, and we take it very seriously. That is why we're having this session. We know that there may well be other sessions in future, so I won't take any more of your time. The clinical placements are important for nursing students. We know that, but why? Yes, it is important because it provides an authentic experience of everyday clinical practice for all our student nurses. They are essential component of nursing education. So I'm going to ask my colleague, Ruma, to now run the next session, which is going to start soon. Ruma.
Hello, hi everyone. As Stephen said, I'm Ruma. I'm an adult nurse by background. My speciality is A&E, and I've been working for the RCN kind of part-time, doing half and half, my clinical and my regional officer role. And as part of that, I've been supporting Stephen with the student lead role in kind of delivering these student ambassador sessions. So thanks for having me today. Lovely to meet you all. As Stephen said, we're going to kind of do a bit of an in conversation style now with our panelists and try and draw on some of the expertise and experience that they can offer to us as student nurses and practice assessors. So we've geared up some questions to direct to each panelist. Understand it probably may spark some questions of your own that you want to ask. As Stephen mentioned before, either pop them in your head, pop your hand up, or pop them in the chat, and we'll come to them afterwards so we can let this first part of the session flow, and there'll be plenty of opportunity afterwards to be able to ask your own questions. Okie doke. So I'll start with Olga. So Olga, what was your biggest worry when you first started your placement, and how prepared did you feel?
I was scared a bit. I've had previous experience as a healthcare assistant, and I was a bit worried that I will treat my placement and I won't be able to find a space for learning, really. I was also a bit worried seeing how nurses in the acute hospital are busy, that I won't be able to find a time for them to assess me, and the amount of work they will be expecting, I won't be prepared for. Yeah, these were my biggest worries, really. Yeah. How prepared I felt. I was really uncertain what to expect. So I was, on one hand, I was thinking I am well prepared, and on the other hand, I was thinking, am I really? Yeah.
Yeah, I guess your past experience as a healthcare assistant must have been really useful, but then
it
difficult
was, but
if you're
it was
going
also
into
the obstacle, really. Yeah.
Completely different role. How do you navigate that?
Yeah.
Olga, is there anything that you would do differently in hindsight going back to starting your first placement?
I think I would make notes, more notes. I think I would have a really small notebook in my pocket and I would just write the questions, because sometimes when I was attending the care or doing some skills, I've had a lot of questions, and by the time I found the nurse who was able to answer them, I forgot them already. So I would definitely find a quiet space to write them on a daily basis, all the questions I've had. Some of them I recalled later, but I think some of them were lost, and they may have been important for me for my next practice.
Yeah, that's a really useful point. It's actually just thrown me back to being a student nurse. I remember I had a little notebook, but didn't start it until kind of end of second year. And in hindsight, if you'd done it first, it would have been a lot easier. Thanks very much, Olga. We'll move on to ask Mona a couple of questions now. So Mona, what is the biggest difference that you found between your placements in first, second and third year?
I think, honestly, Olga, you're better than me. I wasn't a healthcare assistant, so I went in blind. So first year I walked in, I didn't know what to expect. I was literally petrified. And my first placement happened to be a cath lab, and I was like out of my depth. So it was more theatre-based scrubbing, and it's completely one of the, I don't think it was right for me to be placed there to begin with, because I had no experience to begin with, but it was the best, more clinical for me. So that first year was just frightening. But then as you get into second year, you start to pick up a habit. So you start to pick up stuff in first year, you're able to make mistakes, but in second year, you kind of know what you're doing and where you're going and what's happening around you. And also you're able to look within, I think, some of the modules. So in second year, you actually do a lot more anatomy and physiology. So that sort of helps you and tells you, okay, well, if I'm going to a surgical placement, I really want to see the surgery. I really want to see what the issues are. I really want to kind of understand the placement more. It also gives you the opportunity to then seek out sort of specialty nurses within second year, and then sort of understand and get that greater understanding of what they actually do. Whereas third year, it's more, you're in the depth. So you are actually sort of becoming a registrant. So it was my first time actually becoming independent. So I was given my own bay. It's like more minimal supervision. So it's more responsibility. And with more responsibility comes that added pressure. And I think you find it like a sink or swim sort of moment. But honestly, it's the most rewarding when you see that nurse you're handing over to, and then you get that passion and you're there and you're like, you know what, I've done it. I did it, I passed. And it's sort of that moment that you get that feeling, and it's like amazing, honestly. And it's going to be, I think I graduate in 6 months. So hopefully I make a wonderful nurse, and hopefully I take it forward.
I'm sure you will. Thanks, Mona. And then kind of just on the back of that, which I think you've sort of already touched on, but do you feel that you became kind of more prepared then through your placements? As you said, you probably have new challenges year to year, but
I think for my second and third year, I became way more prepared. So in first year, I didn't do any sort of outreach. So in first year, I was sort of just on the ward. Whereas second year, I really understood the importance of specialty nurses. So when they come in, and then shadowing them around the wards and understanding their role. So I got a lot of opportunities, especially I got my PIN for a diabetes, because I shadowed a diabetes nurse. So then I was absolutely allowed to then go ahead and do certain things, whereas some of my colleagues on the ward weren't able to do that. And I would push them to then go, I was like, now you have to go and shadow her for a week and get that. And it was sort of every single time you go out of the ward and experience, and then you bring that knowledge inwards, and it actually builds and helps you. So the more you do that, it prepares you in the long run, and it helps you prepare and cater your care better for patients.
Thanks, Mona. Thank you. That was really interesting. And then next we've got Hannah. So again, I've got a bit of a two-part question for you, Hannah. So first of all, what was the best piece of advice that you got from somebody before starting a placement?
I think it is important if you do a little bit of research. It will be good if you looked where you are going to be placed and read a little bit about the placement the moment you know which placement you are going to go to. Because sometimes you just go there, and then if you have a little bit knowledge, you're sure what you're going to do, or even if you're not sure, at least you have some kind of knowledge, you have a little bit of understanding, and you know what is expected of you, and you know what is they expect from you as well. So it's like it's a balance in between, which I think it works great. And I think it does help you and prepare you as well as you mold yourself into through this journey of to be a registered nurse, which is exciting and hard sometimes, especially when you walk into the first time when you walk in a placement. If you have never done care before, if you have done care before, it's not a problem. But if you haven't done care before, it's become a big issue, because you just see people go to the hospital. Some people have got hospital phobias, some people are afraid of a lot of things. So it's like, now is your moment, and if you're one of them, it's really, really hard. So if you have studied, if you have done a little piece of research, and if you have also contacted your placement prior to attending the placement, that really help you. And then you can go and maybe and ask. We know with pandemic has been a little bit difficult, but before pandemic you could call and then arrange for a tour. But I was lucky because I managed to do a tour even during pandemic. So I had a tour with it where I was supposed to go for placement, and then at least you know what to expect. You meet people before you go for proper meeting, and then you get on to know people, and then you just get on with everything. Thank you.
Lovely, thank you, Hannah. And then it seems like that's probably advice somebody gave to you and you're passing it on now to future students. Do you have any other piece of advice that you would give to our members here for going on placement?
I say a lot of people, because actually as a student ambassador as well, because I'm one of the student ambassador from the university and also from the RCN, whenever I see the new student, I introduce myself and I try to say to them, do not be afraid, ask. Every moment you come, prepare yourself, have some questions, make yourself a target. Every single day have a target and say, this is what I want to achieve. Do not be afraid to ask, and people are there to answer you questions. And even if you fall, whoever you fall, just let them know that you're interested. If you're interested, they are there to show you. If you go holding your hands like this, they know what kind of a person you are. Nowadays, we all know that nursing have changed. It's not like before. You don't have to work directly with your supervisor. They get feedback from the other people. So it is important for you to shine in all areas, because then you know these people are going to feedback for you. And this is how you are going to be assessed, because they know what kind of a person you are, whether you can be able to be reliable, or whether you are somebody who is there to support and help and do what is expected of you. I think that is a peace of mind I give people. I know sometimes what we don't weigh when things go well. I have planned, I've got a piece of paper which I've written all things which, when things are going well, I go back to that piece of paper. Those are my sad moment, and vice versa. When things are going bad, I've got my happy moments. So this is how I work, and I try to tell the student, you cannot be like me and I cannot be like you, because we are individual and we are all different. So you can always try to better yourself. That's all I say to people. And as I say, when you go look forward and you have people, wherever you go to any placement or wherever you go, you pick one or two persons who inspires you most. I like all my list. I've got my list, and when sometimes you have that sad moment, you go look at your list, you laugh sometimes. It's that moment, you laugh, and this keeps me going. And people all the time, whenever I go to a ward, people ask me, what keep you moving every single day? You're always smiling, you're never sad and all that. I have chat, make it easy, because sometimes we make it too serious and then you cannot even approach people. I say, this is me and I want to see this. I ask doctors questions, like today I was on placement and I asked the doctor want to listen to a chest. So I waited for him to finish and I said to him, excuse me, what were you listening for? May I listen? And then I gain the consent from the patient, then I listen. And this is really, when the student sees you as well, you are their role model, and they ask you, how do you gain this confidence? How can you ask? How can you come forward and ask these questions? And I say, you have to push yourself forward, because I think we wait too long, especially when you have a new skill, you wait. Then this buying of time is taking you long. So you need to get on with it, and just get on with it and just say, you know what, she's done it, I can do it. I think that's my main motivation I can give people.
Great, thanks, Hannah. I think there's some advice that even as qualified nurses, I know I'll be taking away with me. I can see Tom nodding along in the corner. Thank you. That was really, really helpful. So we'll move on to Tom, last but not least. So as a practice assessor, Tom, what is the most common issue that students come to you with?
I think it's often not particularly to do with placement itself, but to the world outside of placement, because I think sometimes we don't really acknowledge, and this is, I think it goes through the whole thing of nursing, that there's the world outside of the hospital and how that can impact on how you can function and support. So we know at the moment it is with COVID, with everything else, with all the changes with bursaries and not, and it's a really challenging time to be a student. And many people have caring responsibilities, maybe family, their own children, jobs. There's all these different things going on. And I think it's sometimes people like to put up a front that they're perfect and they can cope with everything, but we know that there is that impact, and it's having that dialogue and coming in and saying, so as Hannah was saying, like doing a pre-visit or having that opportunity to say, like, I know, for example, I've got childcare issues on these days, or this will be difficult. We will do our best to work with you on that, because we want you to flourish, we want you to achieve. But it's that little bit of, if we don't know, we can't help you. And there are so many other people, and I know it can be quite stressful to come and speak to a person you've maybe never met before to kind of what's going on in my life. But you have your placement teams, your university, there's so many people, to have those dialogues with. But I think that's kind of the really big thing, because unfortunately, if you're tired, you're going to come into placement, you're not going to be able to show us your best. And it's just the world. I think if we could all just have a nap before, and just come in just fresh every day. But unfortunately, that's not the real life. And when, unfortunately, as we know, when we qualify as well, there is still those pressures. So that balance and that time management is so essential.
Thanks, Tom. And then another part to the question, if you don't mind. If someone or if a student nurse comes to you and feels like they're struggling with their placement, or they don't like their placement for whatever reason, what advice would you give to them?
I think first of all, it's kind of doing a little bit of reflection, particularly if you don't like a placement, because sometimes it's really difficult to say I don't like a placement, because that's quite an emotive thing to say. It's like, is it that you don't feel that you're getting support? Is it that this isn't the area that you like? Because not everyone, that's one of the great advantages in nursing, there's so many areas you can work in, but is it that specific thing? Is it that you're worried that you're not performing? Because sometimes it can be that feeling of imposter syndrome, particularly as you advance in your placement. And it's so, like, have that little bit of a reflection, or maybe a colleague, a friend, someone else to kind of have that dialogue, let us know as soon as possible. And if you feel you're struggling, and I think it's always interesting when you speak to students, you say, oh, how's university going? Great, I got X% in this essay, or there is that real clear metric, whereas placement sometimes feels a bit airy, like we don't really know. And I think it comes back to having that game plan and that idea of, I know this week I want to do these things, and sitting down with your supervisor, with your assessor that day, and saying, today I want to do this skill in my book. And just pick one skill. Don't try and make yourself do everything, because that's just not achievable. It is that kind of breaking down, but saying, what if I get this signed off, what does that look like for you to sign it off? And this is what it looks like for me, and have that dialogue. Nursing is all about communication, but sometimes we're not always the best at communicating with each other. So, and I know that can be really intimidating, but really own that. And it goes a long way. But if you do feel that you're drowning, and that there is so many people there, and we're all there to help you. So you have, or your on-ward team, but you do have all of your placements, all of your host trusts will have a placement team. You'll have your link lecturers, you will have so many people around you. Just don't shy away from a problem, because unfortunately that's where it gets worse. I think that's everything I've got to say on that.
Lovely. Thanks very much, Tom. No, that was really, really helpful as well. Thank you very much. I think there was a couple of other questions that we kind of had as backup to ask. Now, I'm sorry to take you by surprise, panelists, but if you wouldn't mind me asking you a couple more, no worries if you need a moment to think about it. Mona, we wondered if we could ask you about placement during COVID, because obviously you've had your 3 years to kind of compare of, and how was the differences there? What have you learned from that?
So I started off when COVID was quite light. So it was just a distant memory over, like, way across the pond. So that was my first sort of placement. So there was not really any masks. There was none of that. It was a bit more laid back. Nurses were like up close and personal. They were able to talk to you and have that conversation. And then I remember my first COVID placement. I was in a COVID ward completely, jumped right in the deep end. It was a respiratory ward, so I was in respiratory and half HDU. So as soon as I jumped into that, it was a sort of, let's try and observe social distancing. It was very hard because the facilities that we had as well were not big enough for that, and especially when you're having those one-to-one conversations, it's like in a tiny room. It was very hard, but it was sort of an eye-opener as well, because as a nurse, you have to prepare for anything. So anything can happen. You always have to be prepared and on your toes, and it's an ever-changing world. So there's always different conditions, different illnesses, different diseases that you have to learn about as well. So during that pandemic, it was just learning and after learning and learning and learning. And I think I went to the last sort of ward that I went to. It was when they said that surgical masks, you didn't really need it. You could only wear surgical masks for COVID patients now, and you didn't need the full big mask. I call it the Space Raider, because mine was completely fitted. So it was more of that sort of element, and just taking that away and going through those steps. But it was a learning curve, and it was amazing to have the opportunity to actually work through in this pandemic and support the nurses that I was working with. It was amazing.
Thank you. Thanks, Mona. And then one last one for Ola. I feel like we should use this opportunity because you're in a fairly unusual position that you're studying your mental health and adult at once. Could you tell us a bit how you find that? Do you think it's a useful way to be studying, and kind of any advice that you would give to either just mental health or just adult colleagues?
I'm a bit biased. I think the adult and mental health nursing are complementing each other. So I can't imagine doing just one. And I think in adult nursing, you always have mental health bits. I think Mona can agree with me after her old placements. You always have these bits, especially when you're working in emergency settings or cancer settings. When I've had my first placement, I've had a very big pleasure to meet a psycho-oncologist who's actually doing both things, helping people who have somatic cancer with mental health. And I think it's very good, even if you're studying just adult nursing, familiarize yourself with the most common things in mental health nursing, because there is such a prevalence of mental health issues, especially after the COVID time, that we can't ignore them. They have impact on patients' health, and they have impact on families, and they have impact on our student nurses and nurses in the hospitals. And I think it's nice to just know. And there's so many resources you can use to just grab some information about mental health and prevalence at the moment. Yeah, I would really strongly advise, and I feel really privileged to be able to study both. Yeah.
Thank you, Olga. Yeah, that really resonates with myself as well as a emergency care nurse. You do see that overlap, I think, quite significantly in comparison to some other areas, but it is so important that we have an overview of all of them. Thank you so much for that. I think now I'll hand back over to Stephen, and either between Stephen and Helen, they're going to look at any comments or questions that we've got in the chat, and then allow the floor to kind of open up to our wider members if you've either got a question you want to ask, or just to share your experience, or to give, kind of agree with our student ambassadors that we've got on the call, and Tom, of course. Thank you so much. Back over to you, Stephen.
Thank you, Ruma, and thank you, everybody, most especially our speakers. So this next session is going to open the conversation and the discussion to the participant. This is the time where you can ask our speakers any questions, or raise any points, or let us know or share your own experiences about your clinical placement. So I'm going to start the ball rolling by asking one questions from our speakers. I mean, what is the number one thing that student nurses should think about when they are thinking of going to the clinical placement? Tom, can you answer that question, please?
So I think the first thing is like the biggest thing is just to think about what, and it comes back to what else is going on in my life. I know I can see in the chat there was someone asking about essays and balancing and all of that. If you know, for example, you've got 2 essays due or things like that, tell that placement team, because they might be able to help you with those essays. They might have a specialist nurse that's linked in, or a team that can support. But also, if you're a bit like me, I'm quite a last minute person, you might want the few days before that essay like off. You might just think about, you've 6 weeks, it's 8 weeks, think about your life in advance for that block and plan and have that dialogue. So that's my really big thing. Yes, you can do all of your research and all of that, but you will find you're functioning a lot better if you know that everything else has kind of got its place before placement. So that's probably my big piece of advice.
That's great. Thank you very much, Tom. And in the participant, so I've seen a number of hands up. I don't know in what order. Ellen, can you guide me? Who's
I think the first one with their hand up was, and I'm sorry if I've said this wrong, Adola?
Adela?
Yeah. Hello.
Can you tell us?
My question is about the placement. One of the speakers advised us to, if you're adult nurse student, that you need to learn about mental health. And how do we do that when we don't have, most of our lectures are not on mental health, and I don't think our placement is going to be on mental health. So how do we incorporate mental health into our course?
Okay, thank you, Adela, for that question. Tom, are you able to take that question for us, please? Because this is one of the things that sometimes students have an issue with when they go into clinical placement. How can they incorporate other specialties or knowledge into their clinical components of learning, please?
No, completely. I think we're quite privileged at King's as a hospital. We have a paediatric hospital as part of the organisation, so we have a lot of chronic patients from paediatrics that graduate. That's the term we use into kind of our adult services. So we do a lot of kind of interchange there, particularly with the new SSSA standards. There is a lot more of that kind of interchangeability, and we have SLAM, so we have the Maudsley directly opposite. So again, a huge amount of our patients kind of link in. We do have specialist kind of mental health teams that support our adult services. So it does, I think it's kind of just being slightly mindful that, so my background, care of the older person in the community, we have a lot of geriatric depression scale kind of dialogue there around Alzheimer's kind of diagnoses, just thinking a little bit more outside of just the person. And there is that kind of world outside. No one's asking you to be an expert, but I think there is sometimes really still, unfortunately, a slight stigma around some mental health conversations. And it's really just being slightly mindful that if a patient's being diagnosed with possibly a life-altering condition, there will be a mental health attachment to that. And like, I would say a lot of the specialist nurses in each of the areas have that kind of support. A palliative team is a great team to be involved in. Palliative isn't just end of life, it's a huge kind of dialogue. It's just thinking slightly aside, and it doesn't always have to be about reading a ton of essays and articles. Sometimes it is just having those dialogue with the medical team on placement with the ward, just going, oh, do we think there's a mental health aspect? And people will suddenly pipe up. So don't feel that you have to be super, in the books. It's happening every day around you.
Thank you, Tom, for that insight. Someone else's hand is up, and
Ulubukola?
Ulubukola, yeah.
And then we'll jump to so there's some questions in the chat box as well that we can jump to.
If you just tell us where you're studying and what you're studying, please.
Okay, hello everyone. My name is Olubukola, and I'm studying at University of West London. I'm actually Mona is actually my classmate. We're classmates actually.
Good.
Yeah. So my question, although when Tom answered the last question, he kind of answered my question too. But let me still put it forward. My question is, what support do you think students have in place, that they can make you, what support do you think are in place that students can look out for when they go for placements?
Tom, can I come to you and I'll go to the other panels?
No problem. I think everyone's sick of my voice at this point. I think the really big things is from a university side, obviously, I'm sure you're quite aware of the support networks you have, but if you're not, you will have link lecturers, you will have kind of all the university support side. From placement, if you are in an NHS trust, you will have a pre-reg team. There's lots of different names for it in different trusts, so I don't want to be too specific. At King's, it's the pre-reg team. There are PDNs, and we have 2 7s and 2 6s that kind of go out and support, and a matron who I know quite well. They're very motivated. They're out every day, so you will have that team sometimes. And you will obviously have your supervisors and assessors in placement. I really would recommend you get to know that team, or at least have them there in your back pocket, because that's their bread and butter is placement. So sometimes things might seem a bit complicated, or sometimes the wards don't know. And I have to admit, from a before time, before I knew so much about placement, sometimes it does seem a little bit extra or complicated, but that's what their team is there to support you on a day-to-day. So really get to know that team. That's they are your main hub, and then obviously you will have all of your colleagues, you'll have the RCN reps and all of those other people.
Thank you, Tom. I'm in no particular order. On my screen, I've got Ola. Can you add anything to what Thomas said in terms of support?
Placement sometimes can be a bit tricky, but there is so much support available, which we sometimes are afraid, or we are thinking, oh, it's not as important, I won't be bothering anyone. Yes, do bother. I've had issues on my mental health placement, and they were overwhelming. And then the third-year student from my university said to me, you need to seek support, you need to seek help. I did escalate it, and it was resolved in 2 days. On the other hand, if I would be more keen to resolve it myself and just, get over it, I would probably have not very nice placement. And they resolved it. Some solutions were put in place, and I've had a really nice placement. There is in the trust, I've had my mental health placement. There is like a student lead, and there is a student forum. Just look for this kind of stuff, and don't be afraid to just send email to your university and say, look, this is happening. Maybe it's not urgent, maybe it's not serious, but I'm not feeling very easy about it. Please, can you give me some advice? And they are there to help you. And I think there is a lot of help students are just not using, and trying to resolve the matters in their own way, which is not always the best way, really, because we don't have experience in it. And there is a lot of people who have plenty of experience in resolving matters, which are probably the same with every student. We are feeling that we have very, individual problems, but they're probably repeating itself all the time. So I would just say, give it to the experts. They will help you, because they've had the same experience as you. They were students at some point, and now they are there, and they feel for you, and they really want to help you. So yeah, just ask them for help.
That's great. Thank you, Ola, for that. We have got a number of questions on the chat, so yep. I'm going to pick a few before we go into the people that have put up their hand. We're going to come back to you, so please bear with us. One question on the chat that has come to me is how to balance placement with multiple essays and exam all at the same time. What can students do when they have got competing priorities of clinical placement and multiple exam and assignment? Anna, can you take that question for us, please? Are you able to?
Yeah. Thank you very much. I've always had a tip. Because when I started my placement, actually, I was working, and I remember because I started my placement during my course during pandemic, so I didn't have to go to university. So that was a privilege on my side, which I found very helpful, because my uni is a little bit far from where I study. And as I was planning myself, actually, I was just going through paperwork. I was talking to different people, and I said, what advice could you give? And nobody could, everybody was saying, oh, it's really hard. It's really hard. I don't know what to say. And one day I woke up at 5 o'clock in the morning, and I had 2 assignments. I had an exam to prepare for, and I had an OSCE. And then I have my family, I have extended family. I do quite a lot of few things. And now I was like, what do I do? How am I going to cope? So what I did to myself, I made a strategy. So I said, whenever I know we have an essay, every morning during the week, I wake up, I do 200 words every morning. This is how I do. And then as I go along, depending with what I'm studying, then I spare about 20 minutes every day, if it's exam or whatever I have. So I have a plan. My plan runs for 6 months. Like now I know I've planned for 6 months. I've already written what I'm supposed to do. I know what I'm expected, my placement, I've all to arrange that. So I always have to get my books in advance as well before the university starts. So I go to uni, like even if the uni closes, if I know we open in a week's time, 2 weeks time. So I'm always there before, 2 weeks before. I've collected the books which I need. So I've got them there. And then every single day, every day as it comes, then I'll take the advice from the lecturers. And then as we say, then you seek the help and then you move forward. This is how I work myself. And works out well for me, because otherwise it's overwhelming. As we speak at the moment, I've got 6 things I'm thinking of. So I've got 2 assignments, which are due one after the other. I've got OSCE, I've got drug calculations, and I've got, I think I've got a presentation as well. So, and then placement as well, family. And then you have other things apart from family, because you need to remember that you also need to look after yourself, because if you don't look after yourself, you are not going to function. And they say, put yourself first, because if you're going to be a nurse and you're not looking after yourself, there is no way you're going to look after any other person. So you need to put yourself first, and always remember to have yourself some time for myself. Time for myself is like, you can choose every day, once a week. It depends when it's convenient for you. Maybe take a walk. Not to stay there, just take a walk, 20 minutes once a week or every 2-3 days. Make it a habit, let it be a routine. Because what happened, I think the nurses, sometimes we forget ourselves. So it's like you get many things coming left and right. And you are there to support these people because you don't want to fail them. And sometimes if you forget yourself, then it becomes very difficult, because you have your family, you have your friends, you have a lot of expectation, and all comes to you. And you look at yourself and you say, wow, this is overwhelming. How am I going to function? And also there are some good courses like mental health mentors, which you can always do. I did one, because actually I found myself like I was really struggling, because I think when you are a very sociable person, you have everybody comes to you. And when they come to you, then you have to bring their concerns forward. And I find myself in that situation most of the time. I have students, they tell me, I feel I want to pull out. So I say to them, no, we need to sit down. Before you pull out, what is the problem? So we talk one-to-one. And then I say, with your consent, I'm going to move this forward. And then with your permission, then we maybe have to arrange for a meeting, or with your permission, write what you want and I'll move it forward to the relevant people. Because as Aura said, sometimes we are afraid to ask. And if you're afraid to ask, you will not know. A book is closed. If it's not open, you don't know what is inside it. So I think this is my piece of advice to each and everyone, but we are not the same. So we approach things differently. Thank you.
Thank you, Anna, for that comprehensive advice, and I've learned something from that myself. That's fantastic. Thank you so much. I've got a couple of other questions on the chat. So this one is very simple. I'm sure I'm going to put it to Mona, who's regarded as a practice supervisor.
So practice supervisor is the person that is going to be assessing. So it's not the person that's going to be assessing you. That's the practice assessor. Practice supervisor is any nurse or any sort of healthcare professional on the ward. The rules have now changed, so you can shadow anyone and everyone and gain that experience. And then they can also write a little note on your book. One of the tips, I just want to add something, is some of the students, and I will say this flat out, do not utilize other healthcare professionals. Shadow the physiotherapist. I learned how to auscultate a chest via a physiotherapist because they're actually really good at doing them. So utilize other people, and they will supervise you, and you can help sign off those skills. Please always just look at these people. Then you don't need to learn everything from a nurse.
Thank you, Mona. That's very helpful. One other question before we go into the participant is I'm dyslexic. I'm a first-year student nurse studying adult nursing. I do feel very nervous going into placement, putting all the theories and then putting it into practice and remembering these things. What advice could you give, please? And can I come back to Ola? Are you able to take that?
Yes, with
Just
pleasure.
briefly, what advice can you give the student?
I would say talk to your supervisor and assessor. Talk to your assessor on your first initial interview. Tell them the parts of the practice you're afraid of, you probably think you will be struggling with. You probably by now have some strategies how to learn. If you need more time to write something down because it's helping you, if you need your laptop with you because it's helping you, if you need any other thing with you because it's helping you to learn, just talk to your assessor and he will inform the rest of the nurses by email or by conversation that this student, they need some help with this and this, they need the laptop with them, they need some more time to write things down. For example, they need half an hour every day in between long day or even the short shift to go for a walk, for example, just to, you know, calm down. People are different, and nurses, like anyone else, they do understand the individual, like person-centered care, and they will understand it. You just need to talk to them and make them aware beforehand that you need certain tools to help you to learn, and then they will be more than welcome, more than happy to accommodate your needs. I'm sure about it. If not, if this happens that someone won't be able or won't be happy to accommodate your needs, there is a lead, like student lead in a trust and academic assessor in a university. You can ask them also for some guidance, for some help, as long as you're like trying to be polite and not jump on people and you make them aware beforehand. It's not a problem. I don't think it's a problem.
Thank you so much, Ola. That's very helpful. We've just got in the chat, so somebody else is saying, no, that's very helpful. So, Tom, have you got anything else to add to what Ola said? Because I know this is something that, you know, a few students, not many, thankfully, do face. Sometimes they don't even know that they are in that situation. I mean, what kind of practice assessor do to support students in those situations?
So yeah, we have a wide variety of students with a wide variety of reasonable adjustments that we might be putting in terms of placements. I think, as Ola's saying completely correctly, is letting people know and just kind of know what you need, and don't be afraid to ask. I think that's the really big thing. So we've had things where we've printed handovers in different colors on different kinds of paper because people can read things in different fonts, different sizes. I think it's really difficult in terms of everyone is so different and everyone will have those individual needs, and wherever possible we'll help them develop strategies, because I think the end goal isn't just to get you through placement, it's to get you to be a registered nurse so you can then go off and look after me when I'm old. So it's that little bit of, we want to help you develop the strategies that will help you then when you're working, that you can then, you know, like incorporate. But I think particularly with this individual, because you're on a first placement, like honestly, just be really kind to yourself, and everything that you will be doing is learning. I think back to my first placement and I cried on my first day. So you know, it was yeah, so in terms of just the expectations people can set for themselves can be incredibly high, but just be really kind to yourself, and don't feel that you need to be fully baked on day one. You really don't. That's what we're here for, to support you. But it's a journey, and just, you will have support from the university, you will have support from the trust, and if you need reasonable adjustments, make sure that you know them and that you're happy and comfortable with them, because sometimes you will meet people that maybe don't know, and just having that advocacy is so important for yourself. But if you don't feel comfortable, who can advocate for you?
Thank you, Tom. And Ola, I'm going to bring you in quickly. You put your hands up.
Yeah, I just wanted to add one thing.
Thank you.
From my experience, people who have dyslexia or some kind of problems, some difficulties, they are amazing carers and nurses, because they understand people who have difficulties. So don't let yourself stop from being a nurse just because you have difficulties, because you will encounter a lot of people in your practice who have difficulties, and you will be the person who will understand the difficulties. So you are very precious to us, and just understand it, that nobody is perfect, and there is a lot of patients who are not perfect, and this kind of nurse who is not so perfect will understand people a bit more probably than anyone else.
Thank you, Ola. We're going to go back to people that have put their hands up. I understand some of them have put their hand up for a while. Please bear with us. We're going to try and get through as many questions as possible.
G, sorry if I've pronounced that wrong. You've had your hand up for a little while.
What's your question, G?
Good evening.
You tell us, what you're studying and where you're studying, please.
I'm year 1, studying at Canterbury Christchurch University at the moment. I'm going to start my second placement next week. So I'm just thinking, because actually from my first placement, I wasn't quite sure and how to identify the target or what things I want to develop during the first year, the first placement, I mean, sorry. So I want to know, and from any of you, and just say, any advice about that, please. Thank you.
Thank you.
Mona, did you want to grab that one?
Mona?
Yeah, I don't mind. Just wanted to say, so like certain tips of actually, it's just going step by step in your pad. Just look at what you need to achieve. So within first year, it's mostly personal care. So identifying personal care needs for a patient, dignity, and sort of aseptic techniques. So in terms of that, just go step by step. It's mostly and sort of learn the skill. Shadow nurses, and then I think it's more of a see, then shadow, and then do it yourself. So see, and then you can do one. So the more times you get into that habit of just shadowing and then seeing that effect and then doing it yourself, you'll be able to overcome those skills and then meet those competencies. And just to make you aware, you don't need to fill out all these. That first placement, you've got 2 placements for a reason. It's because they understood that you can't achieve everything in one placement, and that you need that time, and you need different sort of placements. So a really good one where Tom used to work is the care of the elderly, and it helps you gain all of those competencies, because patients that are elderly have a lot of comorbidities, they have a lot of illnesses, they have everything going on. You get to learn about your IVs, your cannulation, your bloods, and then you also get to do your personal care. You learn about moisture lesions. You've got everything there, but just in one placement. So definitely utilizing that placement when it comes about. I am pretty sure that universities will try and aim to put you in either a nursing home or a all care of the elderly ward within your first year. So you don't need to worry, okay?
Thank you, Mona. That's very, very helpful. Anna, you put your hands up. Do you want to add anything to what Mona said?
Yep, I just wanted to mention one thing which I found it very challenging as well for students, especially when it's your first year, first placement, and when you have never done care before. We always hear these questions which says, oh, I've been asked to shadow a healthcare assistant. I think the best thing you could shadow a healthcare assistant for your maybe first, second week, and then you take it from there, because the drag route, you do it the rest of your life, you do the drag route. I've seen placement whereby I've seen students when they come in on the first placement, and this is their first placement, they have not done this before, and the first, it's shocked me one day when I had this patient, and then the thing is that the person want to sit in the office and look at the notes. How am I going to look at the notes before I've seen this person? I would rather see the person, then I'll go and relate to what I've seen. So do not be afraid. If you have to be asked to go and work with a healthcare assistant, you will learn a lot of things with the healthcare assistant. They are your first point of contact. They will teach you a lot of things because they have more experience. They have done this so long time that they have that experience, and do not waste it by saying, oh, I just want to shadow my supervisor or this. And the other thing which I find a little bit a challenge, and especially at this particular time, is whereby the students are learning with their book. They want their book to be signed. So I've tried to explain to the student, and I say, on your shift, see how your shift is going. When the moment is calm, that is the time I go and get my pad. Because do not wait towards the end of the shift that the nurse need to ask to sign your timesheet. They need to sign this for you. The moment the ward is calm, you decide wherever the ward you go, you'll be able to pick up things and say, this is the moment where it's a little bit, normally we don't mention that word calm, but when is that moment, you grab your book, then you go and say, this is it. Sometimes you have a student, they come and they say, oh, this ward, there is nothing to do. Let me tell you, there is nowhere where there is nothing to do, because you can still go to the library, you can still go to in a particular place, you can just go. I do not agree with there is nothing to do. I've done most of the task, and I do not agree there is nothing to do. So when students come to me and they say to me, oh, there is nothing to do, this is boring, this is this, I look at them and I said, oh, wow, this is really, really not going well. And I call them aside and I say, you know what? One thing, you need to be motivated, because if I say there was nothing to do in this place, I will never learn anything. It's your call. You are the one who is assigned. This is your moment to shine. So show what you can bring and what you can take. So take your book, ask questions, and do not also be harsh on yourself, because sometimes the students are very harsh on themselves and they say, oh, I feel I'm not doing very well, I'm not doing much. Do not be harsh with yourself. And I say to them, when they come to me, they say to me, oh, you do this, you can do this. And I say to them, you cannot compare myself with yourself. I'm a second year student, you're a first year student. So I do not expect you to perform the same as me. And these other nurses as well, they are aware, they don't expect the same level as from you. And as we said, we are all individual, are different. I cannot be like Tom. You know, I can admire I can admire how you work and all that, but I cannot be like you, because I'm an individual and I'm different. This is what sometimes we forget to understand, and we keep pushing ourselves very, very hard and say, oh, I'm not performing well, I'm not doing this, I'm not doing this. If you fail something, there is always a second attempt. There is always a third attempt, because, for example, there are some skills you find they are difficult when you do them on the dummy. When you go on the skill labs, they are easy to do, because then you are doing it. No, this person is not telling you, you're not telling them to cough, they are not giving you any reflux. But then when you have to do it in a little person, you see, wow, this shake you the first time, and I will lie to you, and I'm not scaring you, it shakes you. And then when you do the first time, you say, wow, I've done it. And sometimes I find it amazing. Sometimes if you have to go and do a skill, you say, well, when after doing a skill, and then they say, this is my opportunity to go and shine on this skill, and you feel the skill, and then the nurse come and feel the skill, and then they say they have to call the SHO. I say, yes, I've done it, because what? I'm not the only one, because if the legislature, you know, it's a challenge for both of us. And we, you know, you have done that journey. It's something you do every day, but also the anatomy is different as well. So you have to remember all these tips. So that's my tip. Don't be harsh on yourself. Remember, there is always a first, second attempt, and expectations are high, and do not be harsh on yourself. Thank you very much.
Thank you, Anna, for that word of advice. You know, I can't put it any better. Everybody's different, and most important thing from that advice is that you need to get involved to learn. You know, don't be afraid to get involved and do a lot more. You can. I am conscious of time, and you know, we have got a number of other questions to go through. You know, just in case, I just want to ask the participant, do we have any learning disability or children nurses, a student who would like to share their experiences? You know, can anyone share any story, success story? What has gone well? What did not go so well? You know, how can we make it better? Any learning disability student nurse in the audience? Anyone? Okay, perhaps let me go back to the chat. Question in the chat, very good question here. I'm just a bit worried that I might not be learning what I need for each placement. How do I know that I am on track for each placement in terms of what I need to make sure I've learned? Can I come to you, Mona, please?
So the one thing that you need to establish is each placement, you have competencies in your pad. So that is what is set out for you to learn in each placement. So each year you get that pad, but also I would say do one thing in each placement, make your own set of goals, because each placement is way different. So what you will learn in a surgical ward is way different to what you will learn in care of the elderly. So you need to establish your own goals and what you want to learn. So doing a little bit of research on your placement, establishing that, and then also establishing your own goals. One of my goals for my respiratory unit was that I wanted to learn how these big machines work. So NIV, CPAP, when I saw those big machines, I was like, I want to be able to use one in the future. So having the ability and learning that and getting trained by one of the nurses on how to use it was one of my goals, but it wasn't on my pad. It wasn't on there. So just when you see certain things, jump at the chance of actually getting to do them.
Thank you, Mona. There is one important question here which I think is important to ask. One ask, I'm worried about being in the way. Nurses are always very busy. Will I be in their way? Tom, can I ask you to answer the questions, because this is one of the challenges that students face when going to clinical placement. We know about staff shortage sometimes. Students do encounter that, and the practice assessors are so busy, they haven't got time. And what can they do in those circumstances?
I think it's first of all, you're never in the way. You really aren't. You're like, all of our students are an integral part of our team in terms of, we bring you up, we want you to be part of our team in the long run. We've all started as a student. I think that's one of the lovely things about nursing, and that you've got that kind of, where you've come from, and you can see that in day-to-day life. And I think, during COVID, it was really sad, actually, some days when we didn't have so many students in, because they, are the lifeblood of our organization. But I think sometimes, I'm not going to lie and say every day is super, perfect, and we can always teach the way that we would like to teach. And I think that sometimes, in the same way that we want to always deliver the best care to our patients, we always want to deliver the best learning experiences to our students. So when things are really manic, there is an element of, oh God, I've got to the end of this day and maybe I haven't had that. So I think it is that little bit in the mornings, if it's having that little bit of a game plan. And I still do with my students is kind of pull them aside a little bit and go, okay, so we've just had handover, what are we going to do? It might be a really busy day today. What do you want to get signed off? And it is sometimes, it can be for you, as Hannah was saying, to own that a little bit and kind of target that. And I think a really, really big thing is, don't wait till 7 o'clock to get your book signed, because unfortunately I'm thinking of handing over, everyone's thinking of handing over. There's always, it's sod's law, you always get your admission just before 7. So it's that little bit of, if you can go on lunch with your assessor or supervisor, if you can kind of work around them. No, every ward will have lulls. Surgery tends to be when we're waiting for admissions. In a medical ward, it's maybe when the relatives are visiting, so you've got that little bit of downtime. Each area will have its own rhythm, so don't expect day one everything will go perfectly, but have those discussions. Go, I'm really worried I'm going to be in the way, like I'm worried I won't get my pad signed. And the first thing people go, oh God, we won't have that happen here, and this is kind of how we'll do it. But it's have those dialogue, and getting used to the rhythm of the ward. Sorry, that's not the best answer, but it is probably the most honest one.
Thank you, Tom, for that piece of advice. I'm conscious of time, and this point, I'm going to hand over to my colleague, Ruma, to talk to us about, student ambassadors and their roles and how you can become a student ambassador. We have got 3 on our, our speakers. 3 of them are student ambassadors. So over to you, Ruma.
Thanks, Stephen, and thanks again to all of our panelists for answering those questions, and to everyone that's put forward questions and advice. It's really, really useful. I'll just take a couple more minutes of your time. We just wanted to kind of speak briefly about the student ambassador role and what it involves. As you've probably heard us mention, we've got a few student ambassadors on the call today. Our 3 student members that are our panelists are all student ambassadors. I'm sure some of you, probably others of you in the audience, are as well. Some of you maybe have never heard of the role. So we thought we'll just take this opportunity to give you a bit more information about it. It might be something that some of you are interested in. So Helen's very kindly just put a slide up on the screen, which hopefully you can all see, which is kind of just our little brief role descriptor of what a student ambassador is and the 3 pillars that kind of underpin that. So I guess a good way to kind of introduce the role is it's a position for our RCN student members who are really passionate about nursing and kind of want to use this passion to become active with the RCN support to influence positive change for nursing and in their role as a student nurse. So it's a really, really varied role. You can kind of make of it what you want. In a sense, you can have flexibility to decide how you want to use that position as a student ambassador, and I think that's really useful because we recognise that as student nurses you're already wearing a number of different hats, and trying to juggle, as you've said, your placement, your university studies, etc., etc. So we want you to be able to really use that and take it so you can focus on areas that are important to you to support yourself and your colleagues. So examples of this are, a main one is the signposting. So signposting and supporting your peers. So that could be signposting them to relevant resources and services that are available from the RCN. So for example, if you know of a colleague who's struggling in their personal life, you signposting them to the counselling services that the RCN has available. I think that's one that particularly our student members don't always know that you have access to. Another, we kind of try and encourage our student ambassadors and then our student ambassadors to encourage their peers to get involved with campaigning and connecting. Apologies, I'll just pause for 1 second. I don't know if that's really loud. There's a train going past my window. Sorry. That should have let up a little bit now. Yeah, so getting involved with kind of connecting and campaigning. So that's connecting with the RCN and connecting with our campaigns. So things such as our Fair Pay for Nursing campaign, and encouraging your peers to be active members within those. We also encouraging our student ambassadors to kind of share knowledge amongst your peers, and then in turn with the RCN to help influence change. Or this could be, you've highlighted an issue in your university, or there's a group of you and your peers that have highlighted an issue at university, and you think you could utilise some of the support from the RCN and your role as a student ambassador to try and highlight something that you can focus on as a project for improvement. It's an opportunity to share examples of good practice, or also poor practice, and you're really invaluable to us as our roles as kind of officers, and then from the comms side as well, because you're our link essentially to our wider student membership and also the university as a whole. So we kind of sat in our positions as regional officers. If it's not for our membership on the ground, we don't know what's going on. So it's really encouraging that link between RCN members, university, to promote that partnership working. I'll leave it there because I realise I've probably speaking quite a bit and quite fast. Does anybody have any questions about the student ambassador role, how to get involved? Actually, what I should have said as well, if you are interested in getting involved as a student ambassador, there is some more information on our website. You can take a closer look at the kind of role descriptor that Helen's got up here, and there's some more detailed information as well. I think either Helen may have, or we will put in a link in the chat, just how you can access that. And there's an expression of interest form if you want to register your interest. You'll then get put in touch with the with your region and get opportunity to speak to an officer or a senior officer such as myself or Stephen, and we can kind of talk you through the role in a bit more detail and hash out any queries you have. Thank you.
Thank you very much, Ruma, for that important information about student ambassadors. So, Helen, is there any feedback from?
None on there at the moment, but I'm just going to quickly sneak in, if that's okay, and just to say, if everyone can follow us on our social channels, that'd be amazing. We've got the 3 different regions here, but you'll also have your own regions if you're from outside of London, Eastern or Southeast. That's really where you can keep up to date with everything that's happening locally. And it's great to hear from you guys what you're getting up to. We love to see everything, so feel free to sort of tag us in anything, and that's where we can also share everything that we're doing with you guys. So yeah, just a little shout out for everyone, if that's okay. Thank you. Oh, and I'm also going to put in the chat we're going to just put in a little link to a questionnaire, just so that we can get some feedback from yourselves from how tonight's been, so that we can help plan future sessions as well. So it'd be really really lovely if you could just spare not even 30 seconds for us just to answer that at the end. That'd be amazing. Thank you. I'll hand back to you now, Stephen.
Thank you, Helen, for that. Did appreciate it. This is the time to try and wrap up what we've been talking about this evening. And before I go any further, can I just ask Lisa to say 1 or 2 things to our colleagues and the participant, please? Lisa?
Yes, thank you, Stephen. It's been an absolute pleasure to listen to everything tonight. I think there's been some fantastic advice. I want to say thank you so much for our speakers, and also to say thank you to everyone who's attended and for being so engaged in this. I've seen some fantastic advice also being shared in the chat, as well as what our speakers were sharing as well. So thank you so much. Also, I want to say that it's really useful for me to hear the student voice, to hear about your experiences. So in my role as regional director, I see my role as being your voice. So if there are issues, if there are problems, if there are things you're concerned about, I can actually escalate those within my role as well. So it's so useful for me to hear about how things are going and how you find those placements. So I'm going to end it there, but just to say thank you so much all for attending, and I hope you found it really useful.
Thank you, Lisa. I'm going to second everything that Lisa said, but more importantly, I want to thank our speakers, Anna, Mona, Ola, and Tom, for sharing your frontline experiences, your ideas and knowledge and insight with our colleagues and fellow students. We very, very much appreciate your time. So thanks very much. I also want to thank everybody that has attended today's session. It has been really, really useful, as Lisa said, and Ellie mentioned, how useful and wonderful some of the comment that you have actually provided to us today. Your contribution is really, really appreciated. Lisa mentioned about, looking after your interests as student members. Yes, we do. We are always on your side, by your side, and every day. So just remember that we want you to become a student ambassadors in London. Mona is a student ambassador, so is Alan and Ola. Please, put yourself forward, and you will learn a lot more than you might not even think you were learning. But more importantly, I want to thank Ellen and John and his team for the hard work in putting all of this together for us. Everyone that have not been mentioned that contributed in no small way, I want to thank all of you. So thank you. Have a lovely evening.